Good evening, everyone. I'm Dr. Deepanjali Adulkar, consultant radiation oncologist at Fortis Hospital Mulund, Hirandani Pavai, and HCG Kolaba. I'm going to be talking about this paper by Gustavo Vianney, which was published in Green Journal in Jan 2022. It was a systematic review comparing once daily versus twice daily chemoradiation for limited stage small cell lung cancer. It was a meta-analysis of randomized clinical trials. So we all know the small cell lung cancer is an aggressive disease with comprising of almost 15% of all lung cancers, and around 30% of these patients present with limited stage. Now, the current standard of treatment for limited stage small cell lung cancers, which are potentially curable, is chemoradiation. There are several trials who have examined optimal radiotherapy schedule in the past. One of them was Statistic et al., which was in 1999, which compared hyperfractionated twice daily radiotherapy schedule to once daily conventional fractionated regime to a total dose of 45 gray, and it was found that the BID dosing was superior for OS and DFS. On the contrary, a very recent trial, which is a CONVERT trial, which compared 45 gray in 30 fraction BID dosing to OD dosing, dose escalation up to 66 gray. There they found that the dose escalation was not superior. Both the regimens had almost the same OS and PFS benefit. Now, the current ASTRO guidelines recommend 45 gray in 30 fractions BID dosing as the first recommendation for limited stage small cell cancers. But however, we see that in our clinical practice, most of us prefer OD fractionation. Now, this is mainly because of the logistical complexity to execute treatments and concerns about the toxicity. So with this in mind, the authors did this meta-analysis to assess the effectiveness of once daily to twice daily chemoradiation. Mind you, they included both hypofractionated and conventional fractionated OD dosing schedules. So from 1990 to June 2021, eligible RCTs comparing OD and BID dosing were identified through electronic databases. 2 reviewers performed the search, and a third reviewer was called in whenever there were any discrepancy. The meta-analysis was performed to compare OS, PFS, and toxicity, and a meta-regression analysis was conducted to explore other variables, that is fractionation, BED, patients receiving prophylactic cranial irradiation, elective nodal irradiation, and the start of radiotherapy. So there were 5 RCTs, which included a total of 1941 patients, 965 in the OD dosing and 930 in the BID. Median follow-up was 45 months. Various techniques were used across all the 5 RCTs, with majority of the patient pool receiving a hybrid, that is IMRT plus 3D CRT technique for 1185 patient, and around 180 patients receiving purely IMRT. ENI was included, that is elective nodal irradiation was included in 2 RCTs. Now the OD dosing was around median dose of 66 gray, ranging from 45 to 70. That is conventional fractionation, which was in 3 of the RCTs. And hypofractionated was seen in 2 RCTs with a median dose of 42 to 65 gray in 15 to 25 fractions. The BED, that is the biological effective dose for alpha beta of 10 in hypofractionated and conventional OD dosing was similar, that is from 53 to 81 gray. The BID schedule, that is a twice daily regimen, was same across all the 5 RCTs, which is 45 gray in 30 fractions. So these were the 5 RCTs by Turisi et al., Convert, CalGB, which these were randomized phase 3, while Grenberg et al. And Bokwi et al. Were phase 2 trials. Now, when the overall survival was compared in the once daily and BID, there was no difference in 1 year, 3 year, or 5 year survival, overall survival. However, on subgroup analysis, it was seen that the hyperfractionated OD dosing was better compared to twice daily fractionation. Similarly, in PFS as well, the BID dosing and OD dosing, there was no difference, but hyperfractionated OD dosing was better in terms of PFS when compared to BID dosing. Toxicity profile, that is grade 2, grade 3 pneumonitis, esophagitis, was similar in both once daily and twice daily, and there was no difference in response rate, failure rates, or completion of planned RT in both the groups. When the meta-regression analysis was done to find out about different variables, that is the starting of radiation therapy, the BED, prophylactic cranial irradiation, ENI, there was no significant effect on OS and PFS. However, it was seen that the hypofractionated RT did seem to improve overall survival and progression-free survival, which was statistically significant. So the authors concluded that once daily conventional fractionation results in similar outcomes when compared to twice daily. However, hypofractionated radiotherapy is associated with better OS and PFS than twice daily, and hence further phase 3 randomized trials should be explored to validate these findings. Thank you.